Hi, today I have with me Dr. Raghavi, who is the first exclusive laryngologist in Tamil Nadu, and she specializes in professional voice care. Welcome, Dr. Raghavi.
Thank you.
How are you doing?
I'm good. How are you?
I'm fine, thank you. So, please enlighten us, what exactly is a stroboscopy?
Yeah. So when you go to an ENT surgeon for when there is a vocal cord problem, what they do is a usual endoscopy,
Right.
where you can see the movement of the vocal cord. It
Correct.
opens and closes. It's called adduction and abduction. When it comes together, you voice, and when it opens, you take air.
Correct.
So a step more advanced is stroboscopy, where when the vocal cords are adducted, when they are together, there is another three-dimensional movement that happens in the vocal cord. It's called a mucosal wave,
Okay.
where when it's close together, there's a wave that occurs.
Right.
So that examination is called stroboscopy. We cannot see that movement with the naked eye.
Right.
So we use strobe light to actually slow down the movement of the vocal cord,
Right.
so that we can see small minute issues, subtle changes in the vocal cord,
Right.
especially when it comes to professional voice users,
Right.
singers.
Right.
All these people, we can find out how their glottic closure pattern, like how their vocal cords are meeting,
Right.
whether they're about to develop nodules or some other
Right.
issues. All
Very
these
cool.
things we will be able to pick up in a stroboscopy way better than a normal endoscopy.
Very nice.
Especially if somebody says your vocal cords are moving, they're normal, but still you have a voice problem,
Right.
then that is the indication to do a stroboscopy.
Stroboscopy, right. So in a sense that you are able to gauge what portions of the vocal folds are maybe touching inaccurately or inefficiently, and you can sort of understand where a nodule might develop or a nodule is due for developing, and you are able to correct that with therapy. Am I right?
Yeah, the muscular imbalances, all those things we'll be able to see. Other very subtle changes, sulcus can be picked up, a lot of changes, and being a professional voice user, they might be, you might be not using a particular muscle properly.
Right.
All those things can also be assessed with a stroboscopy very well.
Very interesting. So how is it different from an endoscopy or a singing endoscopy? I remember you talking about it. Is it the same thing, or is it?
No, a stroboscopy, you can do it with a rigid endoscope through your mouth,
Right.
or you can do it through your nose.
Okay.
But when you do it through the mouth, they generally mildly pull out your tongue, so you cannot sing with it.
Sing very well, right.
But when there is a flexible endoscope that goes in through your nose,
Like you did for me.
yes, the same one. So
Right.
with that, you can actually, the whole throat, the larynx is in a physiological position.
Right.
So initially it will take about 15-20 seconds to get adjusted to the feeling
Right,
of something
right,
inside.
right,
But then you'll
absolutely.
be very comfortable. So you can sing, you can swallow, you can cough, you can shout, you can do anything
Right.
with it inside. So when the scope is inside, we ask you to sing initially the scales, and then we ask you to sing a very comfortable song, and then a very challenging song.
Wow,
And then the nasality. So we assess all the throat resonance, the nasality,
Wow.
how your tongue positioning is, whether you're squeezing, you're forcing, all these things we'll be able to see with a singing endoscopy.
Amazing, amazing. Are you now, since you have like a camera through a person's nose and you are looking at this entire region, I suppose, right? You are also able to see breathing related differences or inefficiencies if someone is not breathing properly. Is that also possible?
Yeah, with respect to breathing, we can just, when we ask them to sing only, we just, when we look at the posture and breathing, we can find out how their breathing technique is.
Oh, right.
Some, especially the amateur singers, if you see, they breathe from here. They'll be like, once they go up the scale, then they'll be, or they'll use the clavicle. They'll be,
Right.
these kind of, all these, they activate only the upper portions. From the neck, if you take only 150 ml. Whereas if you use your whole lung, it can go up to a liter of air.
Right.
So that is the power.
Very
So
interesting.
when they have very little power only to source the vibration in the vocal cord,
correct.
then they'll have to force the voice and everything. So
Right.
the breathing technique is assessed before an endoscopy.
Amazing.
We look at how what they do when they are singing, what muscles they use.
Right.
The correct one is using the abdomen breathing.
Right.
So
Okay. So
what
that
you
that is
keep
such a
telling,
parallel
yeah.
with what singing gurus
Yeah.
say. They say sing from your stomach.
Yes.
And I'm sure the stomach doesn't produce any sounds.
Yeah.
Right. So it's the diaphragm support that you need to build while you're inhaling, and your diaphragm expands, and so you are taking more air and it is giving you nice breath support, and your singing and your notes in general is stronger, steadier. All those things is what is cited as the reason for making people sing through their stomach, what they say.
Yeah,
it's
so
basically
the-
breathing with diaphragmatic support.
The diaphragm is in between the chest and the abdomen.
Correct.
So when you actually push out your stomach, the diaphragm is pulled down.
Right.
You can't voluntarily control the diaphragm.
Correct.
So you use your stomach to pull it down.
Right.
And with the abdominal muscles, you slowly, with the control over there, you slowly release the diaphragm.
Right.
So that's the concept of abdominal breathing.
Wow, nice. Nice.
So rather than breathing from your apex, you mainly use the lower down muscles, yes,
Basically.
that to control
the flow of air.
Yeah, flow of air. That's
Very
what
nice.
is most important. That's what
Very
they say,
nice.
as you said, nabilarundu.
Nabilindu,
Yeah.
adi vaithilindu paadu.
Yeah.
Or in Hindi they'll say pet se gao,
Yeah.
right? That's what they'll say. So
Yeah.
that's the whole clinical terminology for that you're supposed to breathe through your abdomen and not do or do chest breathing or move your shoulders
Yeah,
or expand
yeah.
your chest. It should be like this through the
Yes.
stomach, right? Yeah, there you go. Very nice. So coming to a related topic, because since you said that you're not supposed to shrug your shoulders and all, so how important is posture and facial expressions when it comes to singing from a very clinical perspective? Can you enlighten us on that?
So posture is very, very important. So it's all physics. All these
Okay.
things is physics. So the air has to be transmitted in a proper channel and then sent
Right,
outside.
right.
So if you look at any great Carnatic singer or an opera singer, so either extremes, they have their ears, shoulder and hip in one single line.
Wow, nice.
So they're
okay.
always straight. They don't droop.
don't
They
do-
don't,
they don't
hold
droop
it
back.
very tight.
Right.
Everything is very relaxed.
Relaxed.
So your back muscles, abdominal muscles, your chest muscles,
Right.
everything have to be relaxed, including your neck, front and
Front,
back.
yeah,
Everything matters if you actually want to sing in the right way.
Right.
So,
So, because a lot of people, even I am guilty of that while growing up, no, I would, if there are high pitched notes that I need to hit, I would end up going like this and squint my eyes, make a face and go like that. The neck
Yeah.
is tensed up and all that. So that is I know that is not the right way to sing it, but is that the reason why you're not supposed to do, right? You're supposed to relax your muscles, your face and everything so that you're able to flow the air a bit more properly. Is that right? Yeah.
Many people, when they raise their eyebrows, go up, they elevate their larynx also.
There you go.
And all this suprahyoid muscles, all these muscles start getting activated and tightened. If you
Right.
just hold it over here and try singing, if it's getting activated,
Right.
that itself means you're actually
Okay.
pulling
like that.
all your,
Oh, wow, okay.
uh,
If you go, oh yeah, there you go. If I go, it's much tighter here, but if I go, it's more relaxed. here,
yeah. So lots of people they just go above, somewhere high up, and
Right.
they actually close down their throat muscles, their
Yeah,
neck, and
right.
a very teeny tiny voice only comes.
Right. It's very weak.
Yeah.
That's what I also demonstrate that in my workshops. When I'm going when I'm demonstrating high pitched singing, if I go it's weak, but if I go if I just drop my jaw
Yeah.
and let my larynx fall back to its
Yeah.
place, it's much more relaxed and I give myself a better chance to hit those notes.
Yeah.
Right?
So the larynx has to be relaxed in the same, we call it vertical laryngeal position, in the
Correct.
same level.
Same level.
The jaw relaxed a little, you can little forward.
Right.
The head especially not too high up. A little up or down is okay.
It's fine. Okay.
But you project your voice more forward,
Right.
you can reach the higher notes with a lot of strength also.
Strength,
It's
right.
not going to be very thin,
weak and like trying too hard kind of a
yeah,
feeling.
yeah.
right?
That strain also won't be there.
Yeah.
So if you want to reach more higher notes, you just project your voice more forward,
Right.
and then you get a much.
Yeah, this
You
is
can try out something like that.
Yeah, this is so amazing because this is what the teachers also tell us, that when we are singing, they say don't make faces,
Yeah.
open your mouth and sing through your stomach. These are all the things that the good gurus basically they all tell us this
Yeah.
only. So if I'm like sitting straight, even breathing through my abdomen, but I'm looking up, tightening my neck, and I go versus it is such a massive difference
Yeah.
in the
Yeah.
whole texture, the tonality, and even a perception by someone who's looking at me when I am singing. When I do it is definitely perceived as, oh my god, he's struggling so much to hit those notes, right? So yes,
even that lower
even
down.
this, this has to lower down. This also has to lower down. This cannot be. It has to be relaxed.
Yeah, it has to.
I'm very guilty of that. I'm forever like this. Right? I'm forever like this.
Yeah.
Nice. Okay, so that's one very important technique that singers need to adopt in order to be able to sing high pitched notes more efficiently, more effectively, and reducing the risk of injuring themselves.
Yeah,
Am I right? Right?
Very much.
Very nice. So a lot of singers, a lot of students of mine, potential students, workshop participants, they come and they ask me how to build more resonance in their voice, how to add that throw and more, they feel that they need to add more resonance. Could you shed some light on what probably can be done in order to do that?
The sound that comes from vocal cord is just like something that comes out of a string.
Okay.
So it is altered by your what we call as vocal tract. Okay, so there is a part in your throat, there's a part in your mouth, and there's a part in your nose. So we call throat resonance, oral resonance, nasal resonance. So for each thing, you can alter it with your laryngeal position. That is where your larynx is elevating or lowering.
Correct.
Your tongue position. If you listen to Kamal's voice, it's all closed throat.
Okay.
He just pulls his tongue back and.
Acha, okay.
Yeah, so you push your tongue out, you open out your throat more.
Okay. When you say push your tongue out, like touching the
lower teeth. Yeah. And opening your mouth. That is for the throat.
Right.
Opening your mouth, you increase your oral resonance.
Oral resonance, right.
So if I continue talking like this,
Yeah.
one thing, clarity will not be there, brightness will not be there.
There you
Whereas if I just open my mouth,
Right.
that single thing itself will actually increase the brightness in my voice so much.
Very nice.
When you're talking also, I mean, many people have this closed throat, closed oral resonance, but while singing, a lot of amateur artists have that.
Right.
That is a very, very common thing that we see.
Right. So you're saying the two things that they can do is, of course, round their mouth and open it a bit more and have the larynx in that steady neutral position that we spoke about.
Yeah, and the tongue
and
position.
The tongue to be forward. Don't pull your tongue back. Like keep the tongue forward. Touch your teeth with the tongue. Right.
Yeah.
What about the nasal resonance then?
So if it sounds like you have a cold, it means adequate air is not coming out through your nose.
Through your nose.
So you need at least 50% of the air to go through your nose to sound very bright and rounded.
Okay.
So what you generally suggest, the singa.
The singa. That drill.
Yeah.
This is completely through the nose, right? Yes.
That probably makes them understand
right
how an oral resonance works, how the nasal resonance works.
Yes.
They have to sit and work with it. It's not just doing it once,
correct.
How it works when you close down your throat.
And understand their own body, because each body is built differently. That's what I maintain in my workshops, that every person is different. Their chest resonance, their head voice, all those are like, they have to understand their own body by doing drills like singa and understanding where they need to strengthen, where they need to work a bit more.
Yeah, even humming will work. There are a lot of techniques, but you have to experiment with a lot of those and then understand what works. You have to understand your body, as you said, and you have to experiment with closed throat, open throat, how each one sounds, record it, listen it back, and then
work forward from it. Wow.
Yeah.
It's a lot of work, yes, but yes, it's needed. If you're serious about singing, I think you need to be careful and like understand your body a bit more and understand how you can deliver a performance without stressing out, without injuring yourself.
Yeah.
Well, thank you so much, Dr.
Thank you.
Raghavi. That was a very informative session. I hope to get back again with you with more questions, and we'll have that discussion one more time.
Yeah. Nice meeting you too.
Nice meeting you too.
Thank you.
Thank you.